Hi, folks. Uh, so in today's special Saturday video, yeah, I know we got a Saturday video. Haven't had one of these in a while, but just like how I've been saying all week, we've had three different impeachments introduced in the Congress at some point or another. We had one on Tuesday the 9th against Secretary of Defense Pete Hegseth, and we've had two on, you know, on Wednesday, the next day. And, well, this is the second one of that category, from Wednesday. And sorry if you hear a lot of noise downstairs. We have the boys over, so they're going to make a lot of noise downstairs. So, anyways, on Wednesday, Democrat Congresswoman Haley Stevens of Michigan introduced articles of impeachment against Robert Kennedy Jr., who is the Secretary of Health and Human Services. So yeah, we're gonna read the impeachment resolution for this one. This one is numbered H.Res 944. The link of it for you to read it will be down in the description below, along with the others. They are on there, I promise. I even made sure of it as it was, uploading and all that. I even got this one on standby on my computer, so I can add it onto the description. So we're gonna read this whole thing. Resolved that Robert F. Kennedy Jr., Secretary of Health and Human Services, is impeached for high crimes and misdemeanors, and that the following article of impeachment be exhibited to the Senate. So only one, compared to the others that have at least two. Article 1, abuse of authority and undermining of the public health. The Constitution provides that the House of Representatives shall have the sole power of impeachment, and that all civil officers of the United States, including the Secretary of Health and Human Services, shall be removed from office on impeachment for and conviction of treason, bribery, or other high crimes and misdemeanors. In his conduct as Secretary of Health and Human Services, Robert F. Kennedy Jr. has abused the powers of his office and failed to faithfully execute the laws of the United States in violation of his constitutional oath and his duty under Article 2, Section 3 of the Constitution. By doing so, Robert F. Kennedy Jr. has imperiled the health and safety of the American people, eroded public confidence in the nation's public health institutions, and stalled decades of scientific and medical progress. In his conduct as Secretary of Health and Human Services, Robert F. Kennedy Jr. has discarded statutory requirements of his office by failing to abide by federal law, including the Patient Protection and Affordable Care Act and Title XIX of the Social Security Act, which threatens the public health and safety of the American people through the diminished capacity of the nation's public health institutions as follows. 1. Robert F. Kennedy Jr. conducted far-reaching, haphazard reduction in force, herein referred to as RIF, including during the ongoing lapse of appropriations, which have diminished public health capacity across the Department of Health and Human Services, hereinafter referred to as the HHS, resulting in lawsuits and haphazard reinstallment actions. Robert F. Kennedy Jr. has falsely testified to Congress that these reductions in force did not terminate any working scientists, despite overwhelming evidence that key staff managing programs and leading public health sciences were included, endangering public health, delaying biomedical innovations, and inciting confusion among public health professionals. 2. Robert Kennedy Jr. unilaterally seized public comment on various types of federal administrative rules and orders in violation of the Administrative Procedures Act. Such elimination runs at odds with Robert F. Kennedy Jr.'s own statements to improve public transparency while also reducing key oversight and consultation avenues used by Congress and public health officials on significant federal actions. 3. Robert F. Kennedy Jr. terminated employees across the National Institutes of Health, hereinafter referred to as NIH, the Centers of Disease Control and Prevention, hereinafter referred to as CDC, and the Food and Drug Administration, hereinafter referred to as FDA, responsible for meeting statutory requirements with respect to record keeping and fulfilling requests for public records eligible under federal laws, including the Freedom of Information Act. These terminations diminished oversight and transparency across the nation's public health enterprise and are impeding Congress's ability to conduct effective oversight. 4. Robert F. Kennedy Jr. celebrated the publication of the Make America Healthy Again report, which repeatedly cited false, misleading, or non-existent research and misrepresented existing scientific findings, seeding confusion among the public and policymakers, and imperiling the health and well-being of the children across the United States. False citations are also in violation of federal research integrity standards and the established norms of the scientific community. 5. Robert F. Kennedy Jr. baselessly attacked the FDA, including going on so far as to suggest reorganization and closure of key programs. These attacks erode public trust in a key regulatory agency designed to protect public health while reducing capacity to carry out statutory requirements. 6. Robert F. Kennedy Jr. announced that the FDA would unilaterally approve the use of lubificorn, a chemotherapy drug approved for cancer treatment to treat symptoms of autism. Such a move is in violation of administrative procedures regarding the approval of novel treatment methods by the FDA, including insufficient scientific evidence of any such risk or advertised effects the use of lubificorn poses to children's health. 7. Robert F. Kennedy Jr. impaired the federal response to the avian influenza outbreak despite overwhelming evidence of a health crisis in the nation's poultry stock, which led to the culling of millions of commercial birds. Robert F. Kennedy Jr. dismissed the scientific and general public concern regarding the escalating outbreak, repeated inflammatory statements such as suggesting the virus should be allowed to run its course, and failed to uphold the federal government's responsibility of managing the crisis, thus endangering food security and public health. Robert Kennedy Jr. has undermined the United States leadership in medical innovation and endangered the future of public health due to cancellation of federal research grants, shuttering congressionally authorized programs, and withholding funds which violated Article 1 of the United States Constitution and the power of the purse by Congress as follows. 1. Robert Kennedy Jr. has canceled more than 2,600 biomedical research grants at NIH, totaling $8.9 billion in federal funding loss for the public health research enterprise. Additionally, over $1.5 billion in NIH grants are currently frozen, further chilling medical innovation, including life-saving clinical research. 2. Robert F. Kennedy Jr. shuttered programs and research grant funding dedicated to improving childhood health, including canceling research of childhood cancer, and NIH participation in efforts to reduce sudden infant death syndrome and reduce capacity to monitor maternal and infant health. 3. Robert F. Kennedy Jr. shuttled key prevention programs and funding streams dedicated to addressing mental health and substance abuse, including the Substance Abuse and Mental Health Services Administration, in violation of federal law, and ending a specialized support service, the specialized support services offered by the 988 Suicide Crisis Lifeline for LGBTQIA plus youth, further compromising the public health of a vulnerable population. 4. Robert F. Kennedy Jr. withheld congressionally authorized funding to carry out the family planning program under Title X of the Public Health Service Act, threatening closure of 865 service sites and cutting access for 850,000 patients to essential reproductive and preventative health services, jeopardizing healthcare access across the United States. 5. Robert F. Kennedy Jr. eliminated various clinical research programs and projects related to prevention of treatment of sexually transmitted infections, including human immunodeficiency virus, hereinafter referred to as HIV, and the acquired infantile syndrome, hereinafter referred to as AIDS, thus undermining public health, including for vulnerable populations. 6. Robert F. Kennedy Jr. discontinued the Centers for Research in Emerging Infectious Diseases, operated by NIH, jeopardizing public health by deteriorating the scientific understanding and the ability to prevent, detect, and respond to future global pandemics. 7. Robert Kennedy Jr. canceled research grants for vaccines development utilizing mRNA biomedical techniques despite scientifically studied benefits of such technology, including the COVID-19 vaccine, imperiling the future of biomedical innovation for cancer treatment, including for childhood cancer. 8. Robert F. Kennedy Jr. abolished the Foodborne Diseases Active Surveillance Network. As a result of this terminated funding, CDC will only monitor 2 foodborne illnesses down from 8, which includes the elimination of Campylobacter and Listeria, which killed 72 people in the United States in 2022. Robert F. Kennedy Jr. has eroded public trust in the effectiveness and safety of vaccines through inflammatory, baseless, and misleading public statements, policies, and other official actions. Such actions also undermine public trust in the entire United States public health system and institutions, thus sowing harmful and unnecessary confusion among the American public regarding trusted sources for public health information as follows. We're almost done, guys, I promise. 1. Robert F. Kennedy Jr. falsely testified under oath to Congress that he would not take actions that would make it difficult or discourage people from taking vaccines, and that he would not undermine the independence of the Advisory Committee on Immunization Practices, hereinafter referred to as ACIP, the premier federal advisory committee responsible for immunization policy. 2. Robert F. Kennedy Jr. circumvented the independence of the ACIP by firing all 17 members of the ACIP and subsequently appointing unqualified individuals to the ACIP, many of whom hold significant conflicts of interest and have publicly opposed established immunization science. This move represents a scientific coup d'etat of immunization science and policy that imperils public health. 3. Robert F. Kennedy Jr. unilaterally fired Susan Moranes, the Senate-confirmed CDC director. Prior to her firing, Susan Moranes was subject to legally dubious managerial pressure by Robert F. Kennedy Jr. and other politically appointed staff of DHHS to resign over her refusal to implement politically motivated, scientifically unfounded policies. Following her firing, Susan Moranes testified under oath in front of the Senate Health, Education, Labor, and Pensions Committee regarding Robert F. Kennedy Jr.'s intention to promote policies, actions, and rhetoric that undermine public health and his failures to execute statutory requirements for his office. 4. Robert F. Kennedy Jr. unilaterally removed the COVID-19 vaccine from the recommended schedule for pregnant women and children issued by CDC without the required input from the ACIP. He then falsely testified before the Subcommittee on Health of the Committee on Energy and Commerce of the House of Representatives that he eliminated the recommendation for pregnant women because there was no science supporting that recommendation. This change created widespread confusion of vaccine safety and installed harmful barriers to vaccine access, including for vulnerable populations. 5. Robert F. Kennedy Jr. appointed David Geter, a known vaccine conspiracy theorist with no medical training, to lead a federal study into vaccines with a focus on scientifically unsubstantiated theory connecting vaccines to autism, further politicizing scientific research and undermining public trust in an immunization safety. 6. Robert F. Kennedy Jr., despite his official capacity as Secretary of Health and Human Services, has publicly voiced support for baseless, scientifically unproven theories regarding immunization safety, including COVID-19 vaccines, and embraced harmful rhetoric wrongfully connecting immunizations to behavioral and health conditions, including during an active measles outbreak. 7. Robert F. Kennedy Jr., despite his official capacity as Secretary of Health and Human Services, publicly supported Dr. Michael Kirk Moore following the dismissal of federal charges against the physician despite the significant public health harm in doing so. Dr. Moore was accused of destroying COVID-19 vaccines, distributing fake vaccine record cards, and giving children saline shots instead of the vaccine at their parents' request. Robert F. Kennedy Jr. has undermined the public health and safety of the American people through policies relying on unsubstantiated evidence and promoting false, misleading, and dangerous rhetoric. These inflammatory statements and actions contradict established science and federal policy to further erode public confidence in the nation's health institutions as follows. This is the last little bit, guys. 1. Robert F. Kennedy Jr. falsely claimed that ensifentrine usage during pregnancy causes autism, a claim that is entirely unsubstantiated, eroding public trust in medical advice. 2. Robert Kennedy Jr. has made inflammatory and scientifically unfunded public comments regarding autism, including referring to the condition as a preventable disease, and made demeaning comments about autistic individuals. 3. Robert Kennedy Jr. ordered the CDC to end fluoridation directives in water utilities despite decades of scientific consensus on the proven benefits of such directives in preventing tooth decay. 4. Robert Kennedy Jr. declared without evidence that cell phones cause cancer and a neurological harm to children, despite such claims having been explicitly refuted by the NIH and other scientific authorities. 5. Robert Kennedy Jr. falsely claimed that AIDS is caused by the use of alkyl nitrates, a class of recreational drugs commonly referred to as poppers, despite decades of research demonstrating the causal relationship between HIV and AIDS. 6. Robert F. Kennedy Jr. falsely claimed that lifestyle changes and vitamin supplements can prevent measles, leading to a documented 39% increase in pediatric vitamin A poisoning cases. In all of this, Robert F. Kennedy Jr. has imperiled the health and safety of the American people, eroded public confidence in the nation's public health institutions, and diminished decades of scientific and medical progress. Wherefore, Robert F. Kennedy Jr., by such conduct, warrants impeachment and trial and removal from office. Oh man, that was a long one, and just out of one article too. So yeah, that's just the impeachment that was brought up against Robert Kennedy Jr., who is, Secretary of Health and Human Services. Now, like the others, it has the only actions it technically has, according to Congress.gov, was that it was submitted in the House and then referred to the House Committee on the Judiciary all on Wednesday. And it's probably going to be left there to die because the chairman of the House Judiciary Committee, which happens to be my congressman, Jim Jordan of Ohio, he's going to let that shit die. Just like the one, obviously, on Trump and the one against Pete Hegseth. So, yeah, he's going to let them die for sure. Even though the House voted to actually table the resolution to impeach Trump. So, yeah, that's kind of where we stand right now. Will there be more impeachments later? I don't know. But since Congress does go to their Christmas break, I believe starting on Friday, they probably will have nothing but pro forma sessions for the rest of the year until I'm going to guess whatever the first Monday of January is, which I think is the 5th, which also happens to be the day that Marjorie Taylor Greene of Georgia is supposed to resign. Although she's cooking up something that she wants to try to force Johnson out from his seat, as in, a motion to vacate the chair. But that's something that we're going to talk about probably sometime next week. I'll find a time to actually talk about it, on how it actually works. Alright, that's all I got for now. Thanks for watching, and we'll see you in the next video. Cheers.